Welcome everybody to the Heroin Task Force quarterly meeting. And here is our slide deck. We're going to get going here. All right. So we are settling into our virtual space here. And I know this is not ideal, but it does give us an opportunity to hop on quickly and get some really great information. We're so excited to have our speakers here today. Our co-chairs for the Heroin Task Force Community Coalition are Mary Simon from Elevate and Larry Nelson, who is one of our County Board Supervisors. And I think I'm just going to turn it to Mary to do a formal welcome to the group.
Oh, good afternoon, everybody. We're so glad that you're here. I want to do a special shout out to our speakers. Thank you for taking your time today to come and share with us information about the PDMP. Appreciate that. I'm looking forward to the conversation. Terry, I believe, I'm not sure if our special guest has joined us as well. There's a reporter from the Journal Sentinel.
Fantastic. Thanks for reminding me. So we do have a Lydia Morrell, who is an intern with the Milwaukee Journal Sentinel, and she is specializing, she's a communities reporter. And she reached out to Larry and they had a conversation and she wanted to learn a little bit more about the Heroin Task Force. So we are welcoming Lydia into the room, virtual room today. So welcome, Lydia. Thanks for the reminder, Mary. Great. Anybody else that I'm missing or any other announcement? Great, thank you. Wonderful. All right. I am going to go ahead and just kind of set the context for the meeting. We're going to start with some action team updates. So our action teams have been doing some tremendous work over the course of the last several months. So we're going to start with that. But the focus of this meeting, we've tried to make each meeting a shared learning opportunity for the team. And this meeting is going to be focused on the Prescription Drug Monitoring Program, or PDMP, and how might we use this data to better understand and inform your work. So not only do we have two wonderful speakers that are going to give us an overview of the PDMP here in Wisconsin, but we've also invited some of our local community members who are using the PDMP in their world and jobs to share a little bit, just to share with you about how they use it and why it is effective for them. And then we're just going to do a little debrief and any kind of, final reflections and next steps and next meeting. But I'm also going to invite you to hang around the water cooler if you would like to, if you will, from 4:30 to 5. I'm going to hang out, and if anybody else would like to hang out, if there are topics we want to continue the conversation, we'll invite those in at that time. I can also create breakout rooms for you to have a conversation if there are a couple of different conversations that we want to have. But kind of think about this as the after conference, if you will. We're walking out the door and we're standing in the hallway and having a conversation, so we can hang for a little bit. So I will be happy to do that for you. And then our goals are always to continue to re-engage with our community partners and to continue to build new relationships, hear from our action teams, give you, if you are new to us, an opportunity to get engaged. There is a report that we provided, that the action teams provided an update, and their contact information, the chairs for each action team are there, so you can get involved. So that is the next hour and a half for us. Any questions from anybody? And if, in fact, I'll share with you the next. So our vision for the Heroin Task Force is to reduce the impact of the opioid epidemic here in Waukesha County through implementing a collective community approach in 4 priority areas: prevention, harm reduction, treatment and recovery, and data and reporting. And those are 4 action teams that are our working action teams. And then again, we talked about today that our focus question is focused on the PDMP. And I threw in a slide, and again, you'll get these slides, but I threw in a slide just to kind of share with you what we've done over the last since September. We brought Paul Krupski in, and he is from the state. We kind of came a little bit more narrowed in a little bit more on our community and brought in the medical examiner's office and heard from our own Captain Casta on what's going on in our county. And then we also brought in March. We had Paige Andrews and Sean Doyne from HIDA, from the North Central High Intensity Drug Trafficking Area. They provided some incredible links and data reporting and things like that for us. And if you want any of these, we don't have a place to house them yet, but that's coming soon. So if you want any of those previous, we have video recordings as well as the slide decks. I'm happy to get them to you, or Tristan Bruno, who is our administrative specialist. But at some point soon, we are going to have some places to be able to house that for you. But today we have Marjorie Liu and Braxton Brown as our speakers, and I will do a formal introduction when we get a little bit closer to their presenting. So at this point, whoops, there's our agenda. You guys have the agenda. Just a couple of quick little housekeeping things. Most of you have been with me before. Please feel free to use the chat. Becca Wright is my tech support. She'll keep an eye on the chat for us. Please feel free to use the reaction button. And that reaction button is also where you'll find the hand raising feature. And that hand raising feature is really helpful for us. If you raise your hand visually, I'll try to see you. But if you use the hand raising feature on the reaction, under the reaction button, you pop to the top of our screen. So we definitely will see you. So that would be super if you do that. And there's your hand raising feature. So it's under the reactions, and
Can you get my
raise your
papers
hand.
off the printer? I forgot to
Okay,
get
I'm just going to mute Larry. Okay. And we talked about that. Just stay on mute if you can, so we don't have the background noises. Please be fully present. This is just a 90-minute gathering, but we've got some really good information for you. And if you are asking a question or making a comment, just kind of say, I'm done, I'm complete, so we don't talk over one another. So thank you so much for that. And at this point, I'm going to let you take a look at this slide for a second. And I use this slide sometimes with teams. What intention do you want to hold for yourself today? And you don't need to tell us or put it in chat or anything. If you want to put it in chat, I invite you to do that. But what intention are you going to hold for this meeting today? Think deeply, be willing to make mistakes. As a facilitator, that happens all the time. So I embrace that. Breathe. So take a moment to read these. Stay open and maintain a sense of humor. And I will share these with you all too. All right, and if you want to pop in the chat your intention, that is fine. And at this point, we are going to turn it over to our action teams for a brief update. So I'm going to, these are our action team chairs. Each one of them will do a report out. And Becca is going to pop into the chat, and it was also in your agenda, but she'll pop into the chat the report that they have created for you. So I'm going to actually stop sharing at this point and pause. Thank you, Becca, for that. Any questions before we head right into our action team reports? All right. I had prevention at the top. So Jake and Mary, would you guys mind starting?
Jake, you want to take it, or you want me to?
Go ahead, Mary, and I'll chime in if there's anything else that you missed, but I know you'll do a great job.
All right. I'm going to spotlight our speakers here while they're speaking.
Oh, geez, no pressure there.
Sorry.
I have a bad hair day. Wow. So Jake and I co-chair the prevention action team. We are right now focusing on our next community awareness, community education effort. Our goal is to try to help people learn how to have difficult conversations around substance use disorders. And so we are working to gather or create videos with different target audiences in mind about how to have difficult conversations. So like, for example, a parent who has a middle school student, and how do they start to talk about drugs and alcohol with their middle school student, or someone who a loved one has a substance use disorder, and how do you start to have that hard conversation about expressing your concern around their use and how to help them. So our goal is to find some of those videos that our goal is to make them very short and very simple. We're going to put them up on a website and then promote those videos there so people can go anytime to see them when they're up at 3 in the morning, or when they're finally get the kids to bed and they just want to check some things out. We're going to put them up on a website, and so that people can access them when it's convenient for them, and give them a chance to learn some new things and some skills. So that's where we're at. Jake, did I miss anything?
No, that's a great summary. It's really about not reinventing the wheel. You know, at first we kind of discussed, do we want to make our own little videos and discussion points? But after a week of research, our team came back and found about half a dozen really great resources. And now we just got to figure out how we can showcase them the right way and present them.
Great, thank you. And you guys hosted a fabulous webinar in the April timeframe, and that information is available for people to review as well, correct? Great.
Yep, it is on the Your Choice YouTube page right now. So eventually, hopefully it'll be on the Heroin Task Force, but check out Your Choice's YouTube page and it's on there.
Great, thank you. Thank you so much. And there's been a couple of references to a potential site. So Elevate is going to be hosting a website for the Heroin Task Force, and we're working on that. So that's work in progress. So we will report more on that in September. All right, thanks you guys. And I'll remove your spotlights and invite, let's see, harm reduction. Who's speaking on behalf of the harm reduction team today? And I can go on if we want to take a pause and think about that, we can come back.
I'm here.
Hi, this is.
Oh, you
this
are.
is-
Okay. Susie's
Oh,
here.
there's Susie.
Great.
I couldn't get off mute because I had pulled up the as well. So
No problem.
I was trying to do both. Hi, everybody. If you don't know me, my name is Susie Austin, and I am one of the co-chairs for the harm reduction action team. We've been working on a number of things. We have started it's called Never Use Alone campaign. This was launched by a gentleman, and it's turning into a national campaign, and it's little cards, information that people can use when they're going to use alone. And there's a phone number they can call so that they won't, if they overdose, someone will send first responders. The Naloxone box campaign we're working on is moving forward. They've been delivered to all the probation and parole offices. We're waiting on, I should be being delivered soon. We've been having listening sessions for in our team meetings with people that are in recovery. That seems to be extremely beneficial to us. What couple of things we've been working towards is fact sheets for people that are substance users, and fact sheets for families as well. We've identified that peer support is one of the most important things in pretty much everything that we do. And we do have Kari on here. She's brand new peer support for us here in Waukesha, and she's going to be working with probation and parole. And we will be hiring one more out of our WCS office. And I had a wonderful meeting with Waukesha Memorial Hospital. So we're starting to move forward, making inroads on using peer services to reach people where they're at when they're substance users. And I think that's about it right now. I don't want to take up.
That's about it. There's a lot there. That is, and you know, as we go through your reports, if there is anything you want or are hoping you would like our community partners to do, please feel free to ask for help, or if you're looking for help pushing out material, things like that, that's what we're here for. So
We've
thanks.
been working on the worth campaign, and that's in the process of just developing what it's going to look like. We've identified community partners, and worth stands for Waukesha Opioid Response Team Helps Because You're Worth It. So we'll be rolling that out hopefully in the not too distant future.
Great. Thanks so much, Susie. All right, great. And the next up is our treatment and recovery team. And I see Colleen has tried several times to get in. Christopher, I know you're here, and I think I saw Sarah as well, Sarah Castillo. No, I'm sure I didn't say that right, Sarah. I apologize.
That's okay.
Are you reporting out?
Sure, I'll report out. So my name
Thank
is
you.
Sarah. Yeah, my name is Sarah Castillo. I'm one of the tri-chairs for the Treatment and Recovery Action Team. Just to kind of reiterate and remind everybody that our goals for 2022 were to establish a MAT program in the Waukesha County Jail, to create transportation option for people who are in need of treatment, but are in rural communities, or even for those in urban communities that don't have transportation. And then lastly, to create a virtual resource guide using 211, some of the resources that they already have. We don't want to reinvent the wheel. So we're going to start working with a survey that was sent out in 2018 to MAT providers, so we could get an idea of who the MAT providers are in the county. Let's see here. There's been some movement on MAT at the jail. There's a group working with the jail administrators right now to bring that to fruition. Let's see here. And and we also have just recently gotten numbers of the amount of people, or the kind of people, the amount of people that we would service for the transportation program. So I think that's it where we are now.
And again, a lot going on in your team, Sarah. Thank you
Yeah.
so much. Thanks
Sure,
so
thanks.
much.
Yep.
And our last team, last but not least, is our data and reporting team. And let's see, I saw Felicia and Adele. I don't think I saw Jerry. Adele and Felicia, you guys okay
Yep.
okay.
Yep. Make sure you hit Felicia too.
I will do that. I got to find her. Okay.
Hi, everybody. I'm Adele Ravoy. I'm the grant and data manager for Elevate and a tri-chair for the data and reporting action team. We are all about numbers, and just like today's presentation, we get more data. So I've been thrilled. I think that the last actual 3 meetings, community meetings we've had, have always been around the data and the importance of numbers. So our big task is now, when we get all this great data, what do we do with it? How do we organize it? Where do we manage it? And where can people access it? So with the upcoming launch or kind of design of a possible website, we're looking at a page just for data. And the committee's task will be to figure out what will that page look like, and what do we want as kind of a direct data dashboard versus links to other sources that may be helpful. We certainly want to make sure that we're providing data that the other action teams can use in their work and need in their work, but also just kind of general numbers that possibly other people that are just interested in what the Heroin Task Force are doing are collecting numbers as well. So it's a huge task. We're not all number geeks all the time, but pretty much we do get excited for the latest numbers to come out on any report. And I know Felicia is a hound when it comes to really good sources of data to try and find and publish. And Jerry's the same. Jerry's a hound too. So
you guys are, and I know you've added a few people. I know Frances Thomas has been added. And,
yes.
And you guys
oh my
are,
gosh.
yep.
Yes.
She's great. She's great. Felicia, anything else to add? And I couldn't pin her because she didn't have her camera on. I didn't realize. Sorry, Adele, we left you hanging out there for a little bit.
Sorry, I had to take care of an urgent situation real quick. And no, I think Adele covered it all. So
Perfect. Perfect.
We have a meeting next Monday though.
Yes.
So yeah, so that's probably the coolest part of this is that we get to advertise our meeting for next Monday, where we're going to be looking at the design of our webpage, and we're going to hear from Frances and her great work. So
they're all doing fantastic work. So just as a heads up, I'm going to remove the spotlights here so you guys can be back in the crowd here. So just as a friendly reminder, we put the link to the reports in the chat. It's also linked on the agenda, and all of the co-chair contact information is there. And many of the action teams articulated their next meeting date. So you have an opportunity to engage if you're new to this and would like to engage. So I'm going to pause for a second and see if we have any questions from our teams, our partners. Yeah, Kirk.
Just a quick comment. So I'm along with John Kettler and Rebecca Luchai are the Waukesha County representatives that engaged with the jail and that initiative around MAT services. We had our first meeting a couple of weeks ago, and I have to say that it went incredibly well. Actually, our second meeting, I should say. And we're sort of getting into the brass tacks. One thing I did want to share is that we have approval from our director to be able to utilize some of the opioid settlement funds to be able to support MAT expansion in the jail. So that's really exciting. And both the jail leadership as well as the WellPath team that is in the jail currently providing services are on board and interested. So we'll see that move forward. But I just wanted to highlight that really our ticket in the door and kind of a compelling argument when we were in I think the more impactful second meeting was that we were representing an initiative from the Heroin Task Force. Talked about the membership that we have and the representation across the community, and that this is really the will of the community. It's not HHS, it's not clinical services. We're here as liaisons for this community coalition, and so I just wanted to highlight that because it speaks to the strength of this Heroin Task Force and the reputation behind it that can drive decision making and actually get things moving forward.
Kirk, thank you for sharing. That is great. That is really good news. Anybody else chime in before we head into our speakers? We have over, I think it's Tristan might be able to help me, over 200 people in our contact list now on the community partners list. That is amazing. And we get usually at least 25 to 30% engaged in these quarterly meetings. So, and many of them are on action teams. So thank you. Much gratitude to those who are working so hard. All right, if everybody's okay, we are going to go into, I'm going to introduce our speakers, but before I do that, I have a couple of quick little poll questions for you. So grab your phone because you're going to need your phone to activate the barcode. So the first question I have for you, you have two choices. You can go to slido.com and put in that number, or you can pick up your phone, go to, like you're going to take a picture and put it to the barcode and click on the little yellow button there. And the question is how familiar are you with the Prescription Drug Monitoring Program, PDMP? Are you guys seeing it? Are you getting oh, you're not. No. Why not? Okay. Oh, they're not because I'm not screen sharing. Thank you. Let's try this again. Okay. Now you can, there we go. Thank you. Thank you, Becca. So how familiar are you with the Prescription Drug Monitoring Program? I thought Marjorie and Braxton, this might be a question that will help you out a little bit to know your audience. Oh, good. Okay, so we're almost 50-50, 40-40, kind of somewhat familiar, very familiar. And there are a few of us who don't know what it is at all. So most of us have some familiarity with it. It's kind of still going. I'll give it give you guys 10 more seconds here. Okay, looks like it's settling. So almost 50% of us are very familiar, 40% of us are somewhat familiar, and 12% of us don't know what it is. So that's an interesting breakout there. The next question is do you use the PDMP in your work? Yes or no? Okay, so about a quarter, oh, flipping here. 25 to 30% or so of us use it in our work. Some do not. And the reason we want to bring awareness to this is so we can help you understand what it is, and you may consider using it in your work. So I think Braxton and Marjorie can see the answer to that. And at this point, I'm going to stop sharing and I'll introduce our speakers. So let me just do a quick introduction. Dr. Marjorie Liu she currently serves as the program lead for the Wisconsin Prescription Drug Monitoring Program, PDMP. She works with the Controlled Substances Board on the management of the PDP operations. She joined the program in 2020, but prior to assuming this role, Dr. Liu worked for many years in the higher education setting as an instructor, a policy analyst, and an administrator. Dr. Liu earned her doctorate in educational leadership and policy analysis from the University of Wisconsin-Madison. And Braxton Brown. Braxton is the program and policy analyst for the Wisconsin PDMP. He has been with the team for about 2.5 years and serves as the main point of contact for end users of the system. Braxton also attended the University of Wisconsin-Madison, where he earned his bachelor's degree in legal studies. So a little bit of on Wisconsin for those two. All right, so Marjorie and Braxton, I'm going to turn it to you. And at this point, you now have authority to share your screen. You're good to go.
Thank you, Terry, for the instruction. Can everybody hear me right?
Mm-hmm.
Yeah. Thank you. And Braxton, if you can share your screen.
I have 2 monitors. I would like to have 3, but
I've got 3, Braxton, just saying.
I definitely need 3. Are you seeing it right now?
Sometimes 3
Not
is
yet.
not better than 2. It's hard to find where my cursor is.
There you go.
All right, thank you. Well, first of all, I want to say thank you to everyone, and especially Terry, for coordinating this meeting and for us to being here. So my name is Marjorie Liu again. I'm the program lead for the PDMP. And to start out, I want to say that Wisconsin PDMP is unique in its own way. For example, we are housed in the Department of Safety and Professional Services, which is the licensing boards and credentialing unit. And many other state PDMPs will be housed in their public health department, for example, and some will be in the law enforcement. And we gotta touch about primary components of the PDMP later on, and then we would showcase our status dashboard, which I think the Felicia and Adele's data reporting team will be particularly interested. And I'm really appreciating the 2 questions beforehand, so we can have a better understanding of our audience. And for those of you who have said that you do not use PDMP in your work, hopefully after today's presentation, you will know that even though if you might not be one of those authorized users to have an account to log into the system, there are a lot of public facing pages with really, really great resources that you will be able to utilize, hopefully. All right, so I will let Braxton say hi to everyone before we proceed.
Hi, everybody. I'm Braxton. As stated in the introduction, I am kind of the main point of contact for end users. So if you ever have any questions, if you do reach out to the PDMP inbox, that's DESPS PDMP at wisconsin.gov. I will likely be the person answering any questions. So yeah, I've been part of the team since March 2020. So that was a little bit of a weird time, but still here, happy to be here, and happy to see everybody here ready to learn today. So,
Great.
and
Thank you,
then before
Braxton.
we get started, since I only have 2 monitors and I'm kind of controlling the slideshow, I'm going to turn off my camera just so I can focus on the slideshow.
All right. And do we really need this highlight, Terry?
I did spotlight you, but I can take you off. I sure can take you off if that's easier. Want me to do that?
Yes, please.
Yeah, you bet.
All right. And again, because the presentation can go really dry, and I wish that we can have met in person. And so feel free to interrupt if you have any question, or just put your question in the chat, and we'll try to be as much interactive as we can. And but with the virtual format, it's a little bit hard for us to really get connected with your eye contact or seeing if you are raising hands. So if I did not notice that you have questions, maybe we can leave the question at the end. And so today, not only we're presenting to introduce PDMP as a program, we're hoping that we're here to hear from you as well. So we're gonna leave a lot of time at the end to have the Q&A session. All right, Preston, you can advance the slide, please. So again, Wisconsin Prescription Drug Monitoring Program, it is housed in the Wisconsin Department of Safety and Professional Services. Next slide, please. So this is a very simple layout of the presentation today. We're gonna go over overview of the program, including components, statutes, enhancements over the years, and again, the statistics, including those, everybody have access on the public facing page. And then we're gonna touch upon some upcoming enhancements, including security improvement, data quality, usability, expanded single sign-on integration, which just got announced, I would say last week only. And then last portion of the presentation will be discussion. Next slide, please. All right, so what is PDMP? And I know that more than half of the audience here, maybe you're the expert of using PDMP, and I would really wanted to hear what your role is in the ePDMP, but this is how we would tell people what exactly ePDMP is. So the Wisconsin ePDMP is an electronic database that collects prescribing and dispensing data on monitor prescription drugs. Monitor prescription drugs are defined as controlled substances in Schedule 2 to 5, or drugs identified by the Controlled Substance Board for having a substantial potential for drug use. So in this category, gabapentin would be the first non-scheduled monitor drugs being monitored starting last year, September, and we'll have more statistics on that later. So ePDMP, through advanced analytics, the system will turn raw dispensing data submitted by dispenser or pharmacies into interactive reports that are immediately accessible to users. And currently, as you can see on the chart with a graph, currently the Wisconsin ePDMP receives more than 715,000 dispensing records per month and generates around 86,500 data-driven patient history alerts per month. And we will have a more slide on the alert that we're talking about here. There are over 72,000 active healthcare professional users, and 725,000 patient histories are queried per month. So this is just a give you a picture the capacity of the system currently. Next slide, please. So 4 components of the Wisconsin PDMP. First is a clinical decision support tool that influences prescribing, treatment, and dispensing decisions of healthcare professionals. And second is an interdisciplinary communication tool between healthcare professionals and law enforcement who submit alerts and access PDMP for investigation. Third is a prescribing practice assessment tool. Specifically, the prescriber matrix report serves as a tool for the prescriber self-evaluation tool and a tool for medical coordinators to evaluate the prescribing practice of healthcare professionals that they oversee. So I know I'm throwing a lot of terminology in here. There are multiple user types that we will go over in details later on. And the final or the fourth component of the PDMP is a public health tool. This is the component that I have repeated saying that non-authorized user will have access to the interactive statistics dashboard. The dashboard provides the publicly relevant statistics such as dispensing trends at the state and county level without a requirement of login. So later on we'll show Waukesha County specific statistics that should show you that you can actually look at Waukesha specifically from the dashboard. Next slide, please. So this is a slide that I'll try to be simple about it. It's a brief history of recent enhancements. And as you can see on the timeline, the Wisconsin PDMP was first launched in 2013. At that time, was still called the Wisconsin PDMP. Now it's called Wisconsin ePDMP. As you can see on the timeline, 2017, that's when the PDMP became ePDMP, enhanced PDMP. And that's when the legislation started to require reviewing of the PDMP for prescribers before they issue an RX monitor drugs. And also during that time, 2017, PDMP became ePDMP, meaning that all the submission from pharmacies and dispensing practitioner will be able to submit or require to report digitally electronic system. Prior to that, what I heard, I wasn't there during that time between 2013 and 2017. A lot of the records are actually manually entered by the staff member to the system. So, and as of May 2021, Wisconsin is connected with 28 state PDMPs in addition to military health systems. So we are not only allowing prescribers to query Wisconsin patients. If you suspect or you know that your patient have out-of-state PDMP record, interstate queries also included in the system. And the next part I want to highlight on the timeline is the Act 266 implementation. Prescriber required to check PDMP, and that's when the 2017 launched of the ePDMP. So the program has gone through a number of user-led enhancements since then, such as single sign-on EHR integration that I mentioned earlier on, that was announced earlier last week. And prior to last week, the single sign-on enhancement will require a fee. And starting this week, and the state government will waive the fee, the monthly service fee, and also we are receiving federal funding to hopefully to sustain that program. And if a single sign-on EHR integration, meaning a prescriber will be able to review PDMP within their EHR system, e-prescribing or EHR integration systems without logging off or switch to another browser to log into the PDMP website. So in our survey, it actually would save about 4 seconds of the prescriber's time. So consider every patient query would save a prescriber 4 seconds of their busy life, and that's significant. So that's the single sign-on EHR integration starting, I want to say 2018, 2019, and then this year we're gonna start to provide free services. And then another user-led enhancement is the prescriber-led alerts. So this prescriber-led alerts will allow prescriber to enter patient or create patient flags to coordinate care with other providers who are treating the same patient. So the 3 alerts that prescribers are allowed to enter are treatment agreements, violation of treatment agreements, and overdose incidents. And we will have the how the alert will be displayed later on a demo of the patient history report. And there are many other enhancements on this timeline, and I'm not gonna go through each one of you, including status dashboard. That's one of the enhancements, and it's an award-winning status dashboard. And later on, Preston will have a demo on that dashboard. So let's see if I'm missing anything important. One last thing I want to say before we advance to the next slide is the PDMP requirements for prescribers to review before prescribing has been extended to 2025, April 1st. So, and that's yeah, 3 years from now. And with that, I will turn the presentation over to Braxton, who will describe the legislation in more detail and give an overview of the dispensing trends.
All right, thank you, Marjorie. All right, so effective in 2016, Act 268 provides that law enforcement agencies are required by Wisconsin Statute 961.37 to submit reports based on reasonable suspicion or belief under circumstances that we will discuss later in the presentation. So in addition, law enforcement agencies may request PDMP reports to aid their investigations without the requirement of a court order. In accordance with Wisconsin Act 266, effective in 2017, dispensers are required to submit to the PDMP by the end of the next business day, and prescribers are required to review the PDMP prior to prescribing a monitored prescription drug. In addition to reviewing dispensing records, prescribers are required to review the alert information in the patient report, as Marjorie stated that we'll talk about that later. So there are some exceptions to the prescriber's requirement to review prior to prescribing a monitored drug. So there's a list of them here. So the first is the patient is receiving hospice care. The second, the order is intended to last 3 days or less and is not subject to refill. The drug is lawfully and directly administered to the patient. Due to emergency, it is not possible to review the PDMP. And the last being PDMP is not operational or other technological failure. And then next, Marjorie will go over who has access to the PDMP and who uses the PDMP or the ePDMP.
Yep. So so this slide shows all the user types, authorized or public access. The first group is the authorized users, including the record submitter, pharmacy submitter on behalf of the pharmacy. Usually this will be the pharmacy data vendor who submit files of dispensing record. And the third will be the dispensing practitioner. The second type of the authorized user account is the primary users in our system, which are healthcare professionals, including their delegates and delegates of the pharmacists as well. So this is the group that they have the full access to patient query. And next group is the situational. That's my language. That's nothing that you can find in the statute. Okay, don't quote me. Situational ePDMP data access, including law enforcement, prosecutorial unit, government employees, investigative unit, medical examiner, coroner. So these three types of user type, they will have to submit their request along with attestation, give sufficient proof that they are engaged in an ongoing active investigation. We need a case number, a little bit detail to justify why they have the reason to access the PDMP patient report. So that's why it's not a full access. And in addition, there were certain information they will be not seeing on the patient report, unlike the healthcare professional users view of patient report. And we'll touch on that later on as well. The fourth type of the authorized user account is the non-patient query account, meaning that they will not be seeing
the patient report. They will be seeing, for example, medical coordinator. These are the people who oversee or coordinate working with the prescribers, delegates, healthcare workers. They will be able to see the prescribers metrics, meaning it's an aggregated data or just analysis of their prescribing practice. So they are not seeing the patient report, they're seeing the prescribers prescription dashboard. And the researcher account, this is in addition to the public status dashboard, a researcher can apply for an account and receive county-based aggregated data on a, I want to say, biannual basis. So this is another user type that the task force data team can consider applying for. And on the right column of the slide, we have the general public access by request. For example, everybody in this room can request your own patient PDMP report. So all you need to do is fill out a form that we have that form on the website for you to download, or you can request a paper form just by contacting us. So it's a self-report process, requires certain documentation to prove that you are the person who you say you are. And the second approach will be a request through patient authorization. So this usually will be a request from attorney, for example, because of a court order or some sort of core investigations ongoing. And so this does not require an account login, and only your own patient report can be obtained. And then the last group of the usage will be, as we have said again, the award winning status dashboard, general access without a requirement of login. So it's on the dashboard, you will be able to see quarterly or annually dispensing records by county. And also the CSB PDMP reports also on the status dashboard. That's the report that Bryson and I put together on a quarterly basis using exactly the same status dashboard. Later on, you will be seeing all the data can be downloaded in a spreadsheet. And so you can use the spreadsheet to come up with the own analysis. Next slide, please. So this is the patient report that I just mentioned. As you can see on the slide on the right, that's the screenshot of a patient report. Of course, we have a test patient on there, Sherlock Holmes, age 67. So on the very top on the left, that's the patient information. And then on the right, where I have the red circle, this is the part of the alerts on two pieces of our two primary group of information. This is the part that with the restricted, cannot say the word, that has only that is restricted to prescribers and their delegates to see. So government employee or law enforcement, any other people who are requesting the patient report, except for the patient themselves, will not be seeing the alert information. So two types of alert here. You can see history of alert of opiates in the last 60 days. This is the opiates notification. And on the right, there a summary of patient alerts, including the first one is the prescriber-led alert. What we just said, that prescriber can enter or flagging histories to attach the patient's report. And the second part is the law enforcement alert submitted by law enforcement. And Preston will have a slide specifically on the law enforcement alert. And then the third type of alerts is the data-driven alerts. So this will be generated by the ePDMP system, including, for example, multiple prescriber alert, high daily doses alert, concurrent benzo and opiates prescription alert. So there are 6 types, and we can get into that later if people feel like to know more about it. So moving up or moving down to the patient report, on the patient report, the map that you're seeing right there, that's the geo mapping of the prescription history, including dispenser's address, prescriber's address, and the patient's home address. So you are seeing, for example, on this Sherlock Holmes patient report, you are seeing like entire United States map. That is because we have a dispensing dispenser's address that is in, I believe it was in Puerto Rico or Mexico. And that's why you are seeing this map is like scaled out all the way down south. And the next part of the patient report, as you can see on the chart, will show that does not have any concurrent opiate and benzo dispensing. So we're not seeing like a shaded area. And this is the chart that will show the daily dose and opiates benzodiazepine concurrence. And the last part of the patient report is the dispensing history details, as you can see, including drug details, data that is prescribed, dispensed, and sold, and patient information, including addresses, payment type, prescriber information, and dispenser information. So I want to say that we have an enhancement released to the production site last year. So as of now, this patient report, the order of those sessions, you can see those upside down triangles. These can be expand or collapse. And then the prescribers or the healthcare professional user, they can actually move around the session. They can move any session that they think is the most important information up to the top, and they can even close the map without seeing the map, for example. So this is one of the enhancements that we had last year. Next slide, please.
All right, so this is back to me. All right, so here you see a chart of our law enforcement alerts. So in addition to a patient's prescription history, prescribers are also required to review law enforcement alerts that are part of the patient history report. Law enforcement agencies may submit alerts electronically via their own ePDMP account or by fax or mail. Submitted alerts are reviewed by PDMP staff to enhance data quality and to optimize patient matching. So once those alerts are approved, they're then attached to the patient report, and prescribers receive an automated email directing them to log into the ePDMP to view the new alert. All right, and then as you can see here, there are 4 different types of the law enforcement alerts. The first one is the suspected violation of the Controlled Substances Act. This alert is used when you suspect a person is committing a violation with a controlled substance. All right, so examples of that include unlawful possession of a controlled substance without a prescription, or a person unlawfully selling or distributing their own prescribed controlled substance. The second one is the suspected non-fatal opioid-related overdose, and that alert is to be used when a person is suspected in overdosing using an opiate-related drug. The third is the suspected narcotic-related death. Alert type is to be used when it is suspected that a person fatally overdosed on a narcotic-type drug. And then the last type is the report of the stolen controlled substance prescription. That alert is to be used when a patient that was prescribed a controlled substance reports that the prescription was stolen from them. And that reporting does have to be to a law enforcement agency. And it's important that the patient is entered as the person affected to ensure that the alert is associated with the proper patient. And then as you can see, based on this chart here, we have seen a steady decrease in the number of alerts submitted by law enforcement in recent years. And this slide goes over the ePDMP as an investigative tool. So again, Act 268 provides that law enforcement agents may request PDMP reports to aid their investigation without the requirement of a court order. So here's some of the important bits of information about using the PDMP report for investigatory purposes. So the Wisconsin ePDMP is a compilation of data submitted to it by its dispensers, and information in the PDMP should correspond to original records kept by prescribers and dispensers. The Controlled Substances Board and Department of Safety and Professional Services make no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the information stored in the PDMP, and expressly disclaim liability for errors and omissions in the information. The PDMP reports are not to be used as evidence and should not be used in isolation to make any determinations about a patient, prescriber, or a dispenser. And this slide will go over the dispensing trends from the years since the ePDMP started up until 2021, which is our last full year of data collection. So we've seen some very encouraging prescribing trends and dispensing trends in recent years. So this chart here shows consistent annual declines in the overall dispensing of controlled substances in Wisconsin, except for the stimulant category that you see there, where you see about a 10% increase since the ePDMP started. So as you can see from the chart, there's a significant increase of the drug class other. Actually, you don't. Yeah, you do see that. Okay. The very bottom yellow line there, you see from 2020 to 2021, there's a steady increase there. And that's because September 2021, due to having substantial potential for abuse, gabapentin became that newly non-scheduled monitored prescription drug. And it was the sixth most dispensed monitored drug in the last quarter of 2021 when it first made the list. So just from September to December, really, it just all of a sudden was like the sixth most dispensed drug in the state of Wisconsin. And then since then, it's been the #1 most dispensed monitored drug since Q1 2022. And the next slide, Marjorie will take. We have some some Waukesha County specific data by drug class.
As you can see, the chart we're seeing here is the Waukesha County specific data, also 2017 to 2021. And if you remember what we just saw from the statewide statistical trends, it's very comparable. It mirrors almost the same increasing trend in the category of stimulants, and then all the other two drug categories are decreasing. But then the drug other is also seeing a increasing trend for the same reason that the reporting of gabapentin dispensing starting September 2021 has led to this increase. Next slide, please.
All right, and I can take the next slide. All right. So finally, as shown in the table here, we've also seen significant declines in the number of concerning patient history alerts since the ePDMP launched in 2017. So as the table here shows, there are 6 different types of data-driven concerning patient history alerts. The first one is the concurrent benzodiazepine and opioid prescription alert. This alert indicates when a patient's active current prescriptions include both an opioid and a benzodiazepine. So that combination significantly increases the patient's risk of overdose, which is why it's an automated alert in our system. The second is the long-term opioid therapy with multiple prescribers alert. And this indicates when a patient has been prescribed at least one opioid prescription from 2 or more prescribers for 90 days or more. The third is the high daily dose of opioids alert. This indicates when a person's active current prescriptions are estimated to provide a daily dose of opioids that exceed 90 MME, thereby increasing the patient's risk of overdose. The fourth is the early refill alert. This is used to indicate when a patient has refilled a controlled substance prescription 2 or more days earlier than the expected refill date based on an estimated duration of the prescription. And that estimate is calculated and reported by the pharmacy. Number 5, multiple prescribers or pharmacies alert. This indicates that a patient has obtained prescriptions from at least 5 prescribers or 5 pharmacies within the previous 90 days. The 5 prescribers or dispensers may be associated with the same clinic, practice, or location, but the Wisconsin ePDMP still views them as separate prescribers/dispensers. And this alert is not a direct indication of doctor shopping. It's just simply to flag for further inspection of the dispensing history. And the last concerning patient history is the multiple same-day prescriptions alert. And this indicates when a patient has received the same controlled substance drug from multiple prescribers or pharmacies on the same day. And then as you can see, since the ePDP launched, since 2017, there's been a 41% decrease in all of the concerning patient history alerts. And I would just like to take the time to thank you for being here today, and then Marjorie will continue with the rest of our presentation.
Thank you. And so the alerts, the 6 type of alerts that Preston just went over was the data-driven alert that I mentioned earlier on the patient report. Just we call it different names at different places. So just want to clarify that. And so this is, before we go into the demo of the website, if we have time, this is our last slide. We're just gonna want to touch upon some of the upcoming enhancement. And first is our 2020 to 2023 3-year overhaul enhancement, holistic enhancement. So we are switching to a data vendor. So after at the conclusion of our project, this is a federally funded project. We will have a better security methods, and we will have improved data quality, especially the patient matching mechanism, and also more user-friendly interface. And then another federal funded project, as I mentioned before, that was the extended single sign-on integration. So currently we do already have a lot of the health systems that are integrated with the ePDMP, meaning that their providers under that health system will be able to log into ePDMP without leaving the EHR interface. And now we are opening up to free services. So anybody who are aware of the health system currently already integrated with the ePDMP, they can actually look up our new integration site to check out how they can get free integration. And with that, we are moving on to the next slide, which is the additional resources. Before that, maybe just pause here. See, I know that we had some question posted on the chat, and also there was one question on the registration form, a very short question, and I can give a quick answer. Does a dentist use the ePDMP? And yes, dentist has the authorized access to the PDMP. They are considered prescribers, and if they have the DEA and they prescribe RX or martial drugs that is with 3 or more of the days of supply, they would definitely have to check PDMP before they prescribe the RX. And then.
Thanks, Marjorie. There was a question from Colleen Allen. Colleen, do you want to ask your question, or we can just read it too?
Can you hear me?
Yes.
Yes.
So usually when we in our MAT program at the clinic, we'll give we'll call the prescriptions into the pharmacy and they'll pick up their Suboxone at the clinic. But now we started to do Sublocade injections, and since those are administered in the clinic, they have to be entered by the physician. And when we look on the PDMP, we don't see a place to enter that. Do you have any recommendations?
Absolutely, I can take that here. So there is an account called the dispensing practitioner account, which is one of the submitter accounts. As you know, just from the presentation, there is an exemption if the medication is administered directly to the patient. You're exempt from reporting that, which doesn't mean that you don't. If you want to, you most certainly can. So the provider would sign up for the dispensing practitioner account, and then they would essentially just submit directly to the ePDMP from there.
Okay. And we'll have your contact information.
Yes.
Because I'm a social worker, I'm not one of the providers, but if they have a question, like one of the NPs, they can give you a call.
Absolutely.
Great.
Yep, so
I'll pop it into the chat for everybody and make sure everybody has it.
Thank you.
Yeah, sorry.
Oh, go ahead, Marjorie.
I might add that if the treatment center, the clinic, is a 42 CFR Part 2 eligible, that's something that currently Wisconsin PDMP cannot collect those administration data. So we can definitely talk to was it Colleen?
Yes, Colleen.
Yes, yes. Just email Preston or me, and we can continue the conversation. It gets a little bit complicated if it's Part 2 eligible.
Great, thank you. And then John, you had a question, John Kettler. Do you want to share your information?
Sure, and I was just typing a second. The state of Wisconsin currently is waiving the monthly fees for integration into the electronic medical records. I assume this is for the single sign-on that was mentioned. The DEPDMP site has a document that provides the technical requirements for the integration. It's kind of heady. Are you able to maybe summarize that and mention if there are any electronic medical records that you are aware of that do have the technical capacities that might save some digging on our end?
Right. So unfortunately, the technical aspect of the integration, we will usually just refer to our vendor because that's a conversation between our vendor and your EHR vendor. So, and as far as we know, the technical barrier mostly would be actually financial barrier in the past, and that's why we're waiving the fee, and so the vendor can go ahead and enhance the system, the interface to allow the integration. I hope I know that I have not answered your question.
That you have answered my, thank you. That's fair. That's fair.
No, yeah,
Absolutely.
but if you wanna send us your email or just fill out the form currently on the website for the free service, and then that registration or the submission of the form will go both to our vendor and PDMP, and then we can go from there, see if it makes sense for the vendor to refer to your case to us or to other technicians.
Okay, wonderful, will do. Can I ask another question? This is kind of a 42 CFR Part 2 question. I have noticed that methadone is not listed on the EPDMP, and presumably that is around medication-assisted treatment for substance use disorders, and that there's a higher level of scrutiny under 42 CFR Part 2 than HIPAA laws. So that's presumably why methadone is not on there. My question is sort of then why is our buprenorphine products on there? I sort of don't understand the difference between, say, it's like Sublocade or Suboxone, the buprenorphine formulations that are used also for medication-assisted treatment.
So buprenorphine, we do have a buprenorphine dispensing record in the EPDMP, and these will be not directly administered. They will be dispensed by a pharmacy or a dispensing practitioner, but not directly administered in the clinic. Does that make sense?
Yeah, except that the new Sublocade is actually an injectable medication and is presumably injected by whomever is distributing it or dispensing it. So sorry for the wonky technical question, but I've wondered for some time.
Yeah, and it's also maybe something to do with the list of being monitored or controlled substance on the CSB chapter. If they're excluded from being monitored or not a controlled substance that a CSB required of reporting, that might be one of the reasons. I remember we received a similar question, and we looked up the drug, and it was excluded, if I remember correctly. But we can definitely look into that and get.
And I think we just had a bell ring in. Dan Bizjack has joined us.
Yes.
Dan is the state opioid treatment authority, oversees MAT, particularly methadone in the state. Thank you, Dan, for joining us today here in the meeting. And Dan has shared in the chat that it is the direct dispensing and not the prescription that is the difference.
Right. So to clarify this, and what Marjorie is getting at is, with the current data waiver prescription rules being modified, an emergency room can dispense buprenorphine products. But for example, I see Christopher on with Clean Slate, they provide prescriptions. So there's the difference. A 7515 facility, which falls under 42 CFR, which dispenses those medications directly to the patients. And as you saw in the PowerPoint, that's exactly one of the exceptions, is that they are directly dispensed to that individual at that facility.
Thank you, Dan.
Thank you both.
And thanks for joining us. Marjorie and Braxton, I'm wondering if we could pause for a moment. I know you want to show us but we have 3 guests here that from our community. Would it be okay if we include their conversation at this point? Is that okay?
Certainly, yep.
All right, great. So I'm going to start with Jess Page. So Dr. Page is she works at Freighter and the Medical College of Wisconsin and is the outpatient pharmacy manager who supports the retail pharmacies within the Freighter Health Network. And we've asked Dr. Page to share a little bit about how she uses the PDMP. And Jess, are you here? Still?
I am. Thanks, Terry.
Great, thank you.
So yes, I've worked in outpatient pharmacy for my entire career. So, for purposes of this, that means retail pharmacies like your Walgreens, CVS. I started my career at Walgreens, and then for the last about 7.5 years, I've been working in health system leadership type roles with the retail pharmacies. The PDMP, I've gotten to see it kind of evolve over the years. And from the get-go, it was just an incredible resource. All of a sudden, this insight, and especially when it started, you really could only see what was going on in your pharmacy, what's filled at your pharmacy, what the patient has chosen to share with you. And then this started to come out and you could start to see what was going on at different pharmacies from different providers, but there was a time delay. Obviously with the ePDMP launch from a few years back, it's just taking it to that whole next level. So honestly, in our pharmacies at Freighter, we check the ePDMP for every controlled substance we dispense. And so what our staff is looking at, and it's asked that our technicians check it for initial review, and then our pharmacists do a double check on it. We're looking at fill patterns. We're looking at multiple providers. We're looking at, is a patient claiming to us that they don't have insurance, but we can see in ePDMP that they've used insurance for past prescriptions. That can sometimes be a red flag. So we check it on every prescription. And early on, before the requirements from a few years ago came in for providers to review, we would sometimes catch saying that providers had no idea. And we would call the doctor and say, did you realize this patient just got this medication 2 days ago from Dr. Smith? And they'd be like, no, I had no idea. So this tool as a whole has it's really changed the course for retail pharmacies, because unlike a lot of the health systems, for example, a lot of our health systems are on the Epic EHR platform. So they can sometimes see what's been prescribed from other systems. Retail pharmacies really operate in a silo. We really can only see what has been dispensed out of our pharmacies. There is not a centralized database. So this is the best option we have to be able to see what's used somewhere else. Since they've added the law enforcement alerts in there, it just adds that extra insight and context when you have a patient come in. I feel like it's made it a lot harder for patients to do the pharmacy and doctor shopping that they did historically. So from our stance, the retail pharmacies has changed our entire practice. And this has been just hugely beneficial for us. And that's kind of my summary overview. I'm happy to answer any questions from the pharmacist perspective as well.
Jess, thank you, Dr. Page. Questions for Dr. Page? So you mentioned law enforcement. I'm going to move right to Laura Reed, and I'm going to actually pause the recording for a moment just because Laura and I were doing a little emailing. It is against their policy to be recorded. So I'm just going to pause and then we can restart and start the demo, the recording again.
All right. And then we're looking at the statistics dashboard here, Marjorie.
Would the statistics dashboard be most interesting to people? That's what I think, because many in the audience probably not gonna have the authorized access to the PDMP, but they can definitely utilize the dashboard.
Okay.
And it's pdmp.gov, wisconsin.gov.
Correct. Yep. pdmp.wi.gov, and I can post that in the chat.
Yep. I'll go ahead and do that.
Oh, got it. Thank you. All right, so our very first tab here next to the home button, we have our statistics dashboard page. As you can see, there are 4 options here. So the first is looking at the monitored prescription drugs dispense. The second is healthcare professional patient queries, which includes delegates. And then the third is the law enforcement reports submitted. And the last is the statistics archives. And that'll actually take you to the Controlled Substances Board reports that Marjorie and I do formulate for the Controlled Substances Board. So we can head to the Dispensing Activity tab. And that will give us an overview of the monitored prescription drug doses dispensed per capita by quarter. And if we go over here, we can find Waukesha right there. Can anybody see that, or do you need to zoom in, or?
Yeah, it's good.
Okay. Yeah, so doses per capita, 23.23 with a population of about 395,000, total doses about 9.2 million. So next chart, we have the top 15 monitored prescription drugs dispensed. Again, that is by quarter. You can also go from all counties to Waukesha. So for the first quarter of this year for Waukesha, those are the top 15 dispensed monitored prescription drugs. As we see, gabapentin probably just going to be #1 in most counties, and it's always going to be #1 in Wisconsin as long as we're monitoring it, most likely.
And Preston, I want to remind you, if we go to the download tab, that's where the general public can actually download the spreadsheet and do whatever analysis that you think useful.
And it looks like you can download the chart too.
Yes.
Correct. Yep. You can download the chart as a PDF. You can download the raw data as a CSV file, and then just export that to an Excel file if you want to do like your own data presentation or own research. All right, we have a monitor prescription drug dispensings by drug class annually. Again, so you can also go to Waukesha for that as well. If I can, oh, there it is. Okay. And then that is since the inception of the EPDMP. And then just since we're running low on time, we can go over to law enforcement alerts. So we have the alerts by county for the entire year of 2022. I'll go to 2021 just since that's our most recent complete year. And for Waukesha, let's see here. So we have 120 total alerts, about 27 for suspected CSA violations, 14 narcotic related deaths, 51 suspected opioid related overdoses, and then 28 reports of stolen controlled substances prescriptions.
And I might add that the number looks low. We believe that those law enforcement alerts are underreported, and we're trying to promote entry of the law enforcement to the PDMP. Another note is that the alerts are attached to patient reports. Law enforcement submit those alerts, but on the report that they request for their to aid their investigation, they actually are not gonna be seeing those alerts. So, but because the alert information are restricted information for prescriber and their delegates and pharmacists.
And then we can also get to PDMP utilization. So we can check the patient queries by healthcare user type. And again, we can look at Waukesha specifically. So for this calendar year in Waukesha, there have been 79,239 queries in January, around 74,000 in February, 86,000 in March, 79,000 in April, 80,000 in May, and then so far about 34,000 in June. I can see the queries by a prescribing profession. Can also take that to a county level base. So for May, since it's the most recent month, if this loads.
It's a very easy to use website, Braxton.
Very easy to use. Yeah, so I implore anybody that's interested, I can just post this link directly. That way, if you didn't see where it was, it's just right up here at the top next to the home screen.
Yep.
But here is the link to the dashboard directly. Sorry, that's still loading there. But yeah, if there's any questions on how to use this dashboard or any other questions on any portion of the site, we can take a couple minutes here if anybody had anything.
Great, thank you. I'm wondering if there are any questions that people are pondering as a result of this presentation. I have a couple, but I really want to hear from you all. What questions are hanging out for you? For me, I'm going to just throw out the question I have, Marjorie and Braxton. Even in your presentation, as well as the data that you were just showing, is the law enforcement reporting. Can you talk a little bit more about that? Because it seems to me that that's really a critical piece of data, and I'm wondering if that stood out to me. I wonder if there's something, I don't know, we should be doing, or I don't know. I'm not sure. I'm trying to understand that a little bit.
Yeah, Preston, if you can go back to the slide where we have the law enforcement alert.
And I guess I'm reaching out to my team here. Did that occur to any of you all as well? Was that a standout to you all, or was that something you expected? That was it. Yeah.
Yeah, so the law enforcement alert, we know that the non-fatal and fatal overdose alert, this has been identified by prescribers as the most valuable information among all alerts to inform their work. But we know that, like we were saying, that they were like singular numbers for the entire year in Waukesha County submitted among one of those alerts, and that does not look right. So we are trying to promote the entry of the law enforcement alert. And these alerts, they are required to report to the PDMP either individually, or they can congregate and submit as an agency. And so we do have the law enforcement account type for them to both submit alerts and also do the patient query request. So as of today, we were still have an internal conversation about improving the process for law enforcement and streamline the process for them to submit reports, because we all know how busy they are, and they have the instant reports required of reporting, and not just for any incident associated with monitored drugs. All other incident reports that law enforcement agencies are reporting on a daily basis. So we're not there yet. We're trying to make it easy for them to enter to the PDMP.
Thanks, Marjorie. And Jake, you have your hand up? Yep.
I was just wondering, with some of the prescription pills, the fake pills now containing fentanyl and things like that, are police still encouraged to put that in if they think the pills might be fake or tampered, or do they submit when there's ever illegal drugs involved to this as well?
Absolutely. So what fentanyl being an opiate, that's definitely something that we would like to be reported, whether it be fatal or non-fatal. That's definitely going to help us get the word out to prescribers. That's going to help us see what areas people are seeing like these counterfeit drugs in. So that's definitely something we would love to see entered into the system.
Thanks, Jake. Thanks, Braxton. How about other questions as we're winding down here? All right. Mary and Larry, maybe I'll turn it to you at this point to just wrap things up. I'm going to hang out if people want to hang out and have further conversation about what this means for us as a task force. I will hang out for the water cooler conversation. I want to share my gratitude, our gratitude to Marjorie and Braxton for being here today, and Dr. Page and D.I. Reed and Christine Zimmerman for being here today, and all of you, of course. And I'll turn it to Mary and Larry.
Terry, I just wanted to add to what you said. I wanted to thank our speakers. Speaking for myself, this was not a program that I was familiar with, so I found it very interesting to learn what it's about and how people are using it. And it's reassuring to know that there is an excellent program like this that can help with some of the terrible problems that are happening out there. So thank you.
Thank you.
Any other comments, questions? I will just hang here and thank you so much, Jess. If there's anything we want to ponder as our water cooler conversation, I will be here. And Marjorie and Braxton, I know we've taken up more of your time, so I appreciate you spending the extra time with us today.
It's been an honor, and we're glad to be here and providing any information that will be, and we'd like to hear from everybody if there's any way that we can you can help us improve the program. That would be
Thank
something
you.
that would be appreciated.
We will make sure, I put it in the chat, but I will make sure to include your contact information in our summary when we send it out next week. And I just also put in the chat, folks, mark your calendars for September 14th. That's our next community partners meeting. So at this point, I'm going to stop the recording.